In a nutshell, tuberculosis is a serious, chronic pulmonary and systemic disease, most often caused by the bacterium Mycobacterium tuberculosis. It is most commonly transmitted by coming into contact with mycobacteria containing sputum of someone with active tuberculosis. When you hear the word tuberculosis or TB, few things come to mind. You might visualize a thin, sickly person with a nasty cough. And you'd be right. Most people with active secondary TB do present with those symptoms. However, today we will be tackling a relatively rarer extrapulmonary complication of TB, which is tuberculosis arthritis. I know, it's pretty puzzling. How can an infection in the lungs go all the way to our joints and give us arthritis? Stick with us and we'll tell you why. In 2015, the WHO estimated 10.4 million new cases of TB worldwide, most of which were concentrated in Asia and Africa. Our country, the Philippines, is one of the 30 high-burden countries for TB. In 2015, there were an estimated 324,000 new cases of TB. If you think about it, that number can fill up about 6 Philippine arenas. Those are a lot of TB patients. And it's true that it's an important public health issue in our country, especially since TB is a lot more common in places with crowding, poor sanitation, and malnutrition. However, what we're talking about today is a form of extrapulmonary TB, which is a lot rarer. TB of the bones and joints is responsible for 10% of extrapulmonary cases, while TB arthritis accounts for only 1% of all cases. That's a drop in the bucket compared to all the pulmonary TB cases in the world. But that doesn't mean TB arthritis isn't important. It can be very painful and debilitating to those who have it. TB arthritis is commonly caused by the bacterial species Mycobacterium tuberculosis. It is a rod-shaped, acid-fast staining aerobe with a waxy covering, which increases its resistance against the body's immune system. TB arthritis is a form of extrapulmonary TB that usually develops as a complication of nearby osteomyelitis or after hematogenous dissemination from a visceral, usually pulmonary, site of infection. This means that mycobacterium from an infected lung manages to get into the bloodstream, travel around our body, and manages to settle into one of our joints. Once there, these bacteria cause a lot of havoc. They induce the formation of confluent granulomas with central caseous necrosis in the joint. The affected synovium then grows as a pannus that erodes the articular cartilage and eventually the bone of the joint. Over time, TB arthritis would result to fibrous ankylosis and obliteration of the joint space. Clinically, TB arthritis has been classified into 5 stages. Stage 1, or the synovitis stage, presents with soft tissue swelling, no bony lesion, localized osteoporosis, and outcome after treatment is excellent. Stage 2 is early arthritis with marginal erosions and outcome is good, only with mild stiffness. Stage 3 is advanced arthritis with subperichondral cysts and loss of joint space. Stage 4 is more advanced arthritis with joint destruction. Stage 5 is ankylosis of the joint. TB arthritis can be diagnosed through aspiration of fluid from the involved joint, then conduction of acid-fast staining or fluid culture. A biopsy can also be done, usually also showing granulomatous inflammation. Radiographs showing the classical triad of tuberculosis arthritis, namely peripheral erosions, periarticular osteopenia, and eventually joint space narrowing, can also aid in the diagnosis of the disease. Multidrug therapy is the norm in the treatment of TB, usually rifampicin, isoniazid, etambutol, pyrazinamide. In general, regimens that are adequate for treating pulmonary TB are also adequate for extrapulmonary TB. The problem would lie in the appropriate duration. Local clinical guidelines recommend multidrug therapy for TB arthritis for a minimum of 9 months. One should also consider the possibility of multidrug resistant TB. In such cases, second-line drugs such as fluoroquinolones can be given, but must be done under hospital supervision as second-line drugs can be more toxic. The prognosis is good with adequate treatment regimens sustained for the appropriate length of time. Children also tend to fare better than adults, and in the case of spinal involvement, deformity, and neurological deficits are harder to reverse. So there you have it, tuberculosis arthritis. Our textbooks may say it's a rare complication, but we mustn't forget to contextualize. In a country like ours, where the burden of TB is high, knowing about complications like this will equip us with what we need to fulfill our duty to fellow Filipinos. May all that we read, study, and do as medical students be the building blocks of our ultimate goal to serve the underserved. Thanks for watching!